All right, welcome back, everybody. Now, on Sunday, 8 young women between the ages of 15 and 23 years died after a staircase collapsed at a tavern in Khayelitsha on the Cape Flats. This accident highlights some of the causes of deaths in South Africa's youth population group. Yesterday, Statistics South Africa released a report on morbidity and mortality among the youth of our country for 2013. Well, joining us now to talk about this report, we have in studio Stats SA's Kefiloe Masiteng, who is the Deputy Director General for Population and Social Statistics. So good to have you in studio, and welcome to Morning Live.
Thank you.
All right, so we look at the figures here, and what I'm reading is that over 77,000 South African youths died in 2013. That is scary. 77,000. I mean, is this a very, I mean, is it a shocking figure to you?
It could be a shocking figure, but we also know that there have been incidents that about 19 million of the people in the country are the youth, and that is about 36% of the population. But now when we look at the deaths, it is not always and usually expected that the young people would die in these numbers that we see. But we see that the diseases like TB, the diseases like HIV are now being the diseases that are taking the younger people earlier than it is necessarily so.
Yeah, yeah. All right. I mean, when we talk about the youth, we are talking between the ages of 15 and 34 years old.
Yes.
But according to those statistics, less than 30% of these deaths, of those 77,000, were unnatural deaths. So that's important to go into. So let's talk about that now. What were some of the causes?
The unnatural causes would be the causes where people would be dying of injuries, stabbing and gunshots. And we are also seeing that the age groups between 19 and 24 are the age groups that are more vulnerable to the types of behaviors, and they die from that types of unnatural causes of death.
Yeah, okay, so that's more violence-related
Violence-related, and it's also based on the type of life that those young people start to venture into as they grow.
Yeah. What is the biggest cause of death amongst the youth?
It is still TB and HIV.
TB and HIV?
Yes.
Yeah. I mean, what does that say about our education and awareness drives?
It is very important to understand that I think by now we are starting to see the stabilization of deaths, but many people are already infected. Many people already are sick. So what we start to see is to try and promote more care, promote more healthy living styles, and for people to start to realize that these are the prospects of finding yourselves dying earlier if you do live in a particular way, if you drink, if you venture into sex too early. Those are some of the risks that people would have. Therefore, more health awareness and healthy lifestyle and healthy promotion programs would be essential, especially for the young people, if we need to preserve them for longer than they currently are.
Yeah. When we again dig further into these numbers, we see that that male youth, it's a higher statistic than the females. Mm-hmm. Why is this? What do we read into that?
What happens is when we look at the statistics, we start to realize that when we get to those areas that talk about the people dying more based on unnatural deaths, those are more attributable or more amongst the young males than the young females. So those are the aspects that also increase the mortality amongst the males as compared to the females.
Yeah, yeah, okay.
Behavioral issues. Now
we see that this is measured over there is a 10-year period that has been looked at, but it shows that there seems to be a peak in 2005 when it came to the death of youths, but it slowed down substantially.
Yes.
And then it seems to have gotten better. Mm-hmm. Again, what is the case? Why is this?
Total mortality in the country has also increased between the years 1997 when the system started and 1998, and then in 2005, I think that was the peak of HIV also and the peak of those deaths that we saw.
Yeah.
But since 2007, 2008, we have started to see a little bit of a reduction in the numbers of deaths, to an extent that we have seen actually from the year 2011, there is reduction in the total number of deaths in the country. We are seeing better longevity, and then the bigger and longer levels of living, and the life expectancy of the population is increasing. So the story overall is that there is improvement in terms of the living conditions of the people, and people are living longer.
Yeah.
But the challenge that we are still living and dealing with is that many people had already gotten sick, so that is the tapering type of progressive that we see in the diseases and the deaths.
Provinces, if we break it down into provinces, we see that KwaZulu-Natal and Mpumalanga and the Eastern Cape are the highest rates for youths. What does this tell us about those provinces and perhaps the situation for the youth?
It tells us, one, about KwaZulu-Natal, it is a highly populated province. It is the second one after Gauteng. So immediately around that one, you also realize that that is the risky age group that you see. The highest numbers of youths are found in those provinces. And therefore, those are the provinces that are also a bit shaky in terms of their economy and not so well in terms of some of the areas of youth development. So when you see those things, it also says to those that are in the policy-making environment, let's go and look at the youth in those provinces mainly.
And also, just finally, I think what alarms me is the percentage of youth covered by medical aid is less than 15% in the country. Now that is that's a worrying figure to look at. It
is worrying. One, it starts with the high levels of unemployment for youth. Therefore, they cannot get medical aid because they are also highly unemployed. But secondly, it means that many of the parents that do have medical aid might not be many of the parents that are co-opting or putting their children on the medical aid. Thirdly, I think it's a lot of the youth that are not employed, not in school, and those are the youth that are also very vulnerable.
Indeed. All right, let's leave it there for now. I know that this would be on your website. You can read the full report. That's statsa.gov.za. All right, thank you for talking to us here on the program. Kefiloe Masiteng, the DDG for Population and Social Statistics, talking about the morbidity and mortality levels among the youth of South Africa report for 2013. Let's take a break. We'll see you after this.